Today we're going to be talking about working in the emergency department. Hi everyone, my name is Marcus and I've just spent my last 3 months working in the ED. There's lots of great things about working in the ED, but ultimately I don't think this is the career path for me. So join me today as we talk about why ED was great, what I liked about it, what I didn't like, and what I would do differently if I was to go back and do it again. So to start off with, what is ED like? So in the hospital, you do ward rounds, you see your patients, you do the jobs, then you're done for the day. But in the ED, you have a constant stream of patients coming in and you pick one up, deal with them, sort their problems, and then pick up another one. And actually sometimes you have multiple patients going at the same time. So you pick up one after the other and you're kind of continuously working through this process of seeing a patient, figuring out the problem, treating the problem, sending them home, or referring them to an inpatient service like general medicine, orthopedics, or pediatrics. One of the great things about ED is its team environment. As a junior doctor, you're working closely with your registrars, your consultants, the nursing staff, the physios, so everyone in the ED is basically part of your team. There is much less of a hierarchical structure where you might get in a medical or surgical team. In a medical or surgical team, you have a consultant who makes most of the decisions, and then that trickles down to the registrar, and then the house officer makes very little. Oftentimes you might feel like a glorified scribe as the house officer. But in the ED, it's a much more level playing field. As a house officer, you still see a patient, you work them up, figure out the problem, and treat the patient. Of course, you can still discuss with the consultant, or you can run your plan past the consultant, but ultimately you are the treating clinician. That creates a workplace where you as a junior get to make a lot more decisions and learn to be a good clinician as you take responsibility for each of the patients you see. The second thing I really like about ED is the scope of practice. So ED is really a generalist game. Anything can come in the door. So you have to know a little bit about everything. And as a junior, it's a great chance to learn a bit about everything. For instance, on a shift, I could see a general medical case, someone who's come in with pneumonia, COVID, or flu. And my very next patient might come in with abdo pain that turns out to be cholecystitis that needs to go to the surgeons, followed by a 5-year-old kid who's coming in under pediatrics. So there's such a broad range of things that you can see in a day, and I think that's excellent. Especially as a junior, when you're starting out as a doctor, you have to learn the medicine. What better way to learn than to actually see cases and see patients? In the ED, you get to see a bit of everything, and that really builds your skill really quickly. Another really strong positive about working in the ED is you develop your clinical reasoning skills. You see a patient and you have to figure out what's going on for them. When you're working in a medical team or a surgical team on the wards, the puzzle has already been half solved. You've already got a vague picture of what's going on, but in the ED, people come in with a set of problems and a set of symptoms without a diagnosis attached to it. And that's your job as a clinician to figure out what's going on with them. That makes ED the perfect place to practice your clinical reasoning, putting the symptoms together, the lab findings and the investigation results to form your own diagnosis, and from that diagnosis, seeing how you can treat the patient. This develops really good clinical reasoning and helps you become a more independent clinician. You're no longer depending on your registrar consultants to do the diagnosing for you, rather you are the person working them up from scratch. And I think that's an incredibly valuable skill that every doctor must have, and as a junior, that makes working in the ED an incredible time to develop this skill. Now, the other thing that I really like about working in the ED is the procedures. On the wards, sometimes you get stuck down with paperwork, doing referrals, making phone calls, discharging patients, and you don't get much opportunity to do procedures as a junior. ED is a very different environment. Anything can come in the door, and often there'll be procedures that needs to be done. So some procedures that I've done in the ED included suturing wounds, various types of lacerations, putting in femoral nerve blocks, putting in Behr's blocks, or different types of anesthetics to help with their pain while you deal with their acute problem, and putting in ring blocks, which I haven't done before, doing nail bed repairs, removing foreign bodies for eyes. So there's a whole range of things they could learn to do in the ED. Putting on casts as well. Me as a very procedural person, and I really like doing practical things and being hands-on in medicine, these are great for me and I really enjoyed this aspect of working in the ED. One of my highlights in the ED is nights. So on nights, there's only you, a senior house officer, and a registrar on that shift. So 3 of you holding the fort for all of ED. If you want to know more about ward nights, check out this video that I made earlier. But compared to ward nights, this is quite a different experience. On the ward night, you're kind of just putting out fires and bandaging things until the morning. But on ED nights, you're still seeing new patients coming in with new problems, figuring out their problem, and then treating the problem before sending them on their way or bringing them into the hospital. There's no longer a consultant that's on site who you run everything by, but you get a lot more confident in your work because you just have to call a few more shots than you would otherwise have to if you're just on during the day. But what I find really good about nights is there's a lot more opportunity to be involved in certain things like procedures, because there's no clinical nurse specialist on nights, it's just you. So anything that needs suturing, foreign body removals, blocks, you're it, so you get to do those. So yeah, compared to a ward set of nights where you get a lot more downtime, on ED nights, you've still got more patients to see, so one after the other. You don't really get that time to go and take a nap, which might be a bad thing sometimes, but at other times it's actually really good because you stay awake. There's always something keeping your mind occupied, and the shift just goes by a little bit quicker than you would if there's a lot of downtime and you're waiting around. So these are some of the things that I really enjoyed about working in the ED. But with ED, there come some challenges as well. For most people, I think the hardest thing with ED is the shift work, and definitely that was something I found, was working shifts where you don't have a regular schedule, coming from a schedule that is the same every single day except with a long day somewhere or a weekend somewhere instead of nights. ED is all over the place. Every week looks different. This makes planning your life around it a lot more difficult. And I really struggled with that. You have a few day shifts, then you have 2 days off, then you're going into evening shifts and then night shifts. It's just all over the place. And for someone like me who like a little bit of order in their life, this makes it a lot more difficult. It's also incredibly challenging for your social life. In my 13-week run, I ended up working 7 weekends, 4 set of nights, lots of evening shifts, some day shifts as well. And your schedule just don't tend to line up with other people. Your days off are in the middle of the week where other people are working. So it's a lot harder to plan your life around these things and to maintain a social life. And talking to lots of people, this is the biggest challenge. The third thing that I find really challenging on ED is managing your breaks. You're seeing patients one after the other, and because things are always happening, you don't really get a lull in your work. There isn't really a clear endpoint unless you've done enough that you can temporize them and move on and have a wee break before coming back. I was really poor at doing this in my first few weeks. I would see a patient after another, and before I know it, it's 2 o'clock in the afternoon and I haven't had lunch yet. I haven't even stopped since 8 in the morning. And because you're doing things all the time, it often feels like you can't take a break and you almost need to see another patient because there's always patients waiting. The waiting room is almost never empty. I've only come across that maybe once or twice. So having breaks is a little bit harder, and I found that quite challenging for me on ED. So if I were to go back and redo my ED run, what's some advice that I would give myself or give anyone who's about to start an ED run? Like I said earlier, one of the challenges with working in the ED is the lack of routine because of the shift work. So if I was to go back, I think I would try to structure my day around the shifts rather than time of the day, doing something at 7 a.m. every day, waking up at 7 a.m. and going for a run. That just doesn't work in ED because your sleep schedule is all screwed. You're doing night shifts, evening shifts, day shifts, all over the place, and you can't have a regular cycle. So maybe structuring around the shift is a better way to do it. For instance, going to the gym every day for an hour before your shift starts, so it's all related to the shift work. That way things won't get missed and you'll still be able to do the things you love. The other thing I would recommend is really planning things well in advance. What I mean by this is your days off is going to be a bit more sporadic. It won't be every single weekend, so you can just tee up something the day before a weekend and go hang out with your friends. It takes a little bit more planning. So I'd say if you plan ahead and figure out what days you're off, what days your friends are off, or maybe your other ED colleagues are off, then you can plan to do things together. Another pointer would be to kind of maximize or multitask, if you'd like. What I found tricky on ED was fitting in exercise every day around a 10-hour workday that happens at different times of the day. What I noticed many people doing is just cycle into work and cycle back. By doing that, you've got if cycling is your recreation or if that's your exercise, you've done that, just going to and from work, and you're just that much more productive. You've already done something which you would do anyway, get to work, but you're also doing something alongside it, so your exercise and recreation. And if I was to go back, I'd do that a whole lot more. My next piece of advice is to pace yourself. What do I mean by this? In ED, it's really easy to just see one patient after another, and that's definitely what I did at the very start of my rotation. On my earlier shifts, I would see one patient, treat them, move on, see another patient, treat them, move on, see another, and this will continue and continue. But before I know it, I've seen so many patients and they're all under my name, and then you realize you have to go back and check the scan results, check the blood results, change the management, and that becomes too much going on at any one time, and you're not really able to gather all your energy or enough energy to treat the individual patients well. So to pace yourself will allow you to not only treat your patients better, but also conserve your energy so that you can stay energetic throughout the day and do the work well. But also ensures that you're able to have breaks because you're not having too many things going on at the same time. And ultimately, it's probably going to make you more efficient because you're not trying to go back and catch up on everything because you've bitten off more than you can chew earlier on, but rather you can go at a steady pace and sustain that pace throughout the day, which is much more important. It'll make your day better and you'll enjoy the work a lot more. So these are some of my advice for working in ED. If you worked in ED, I'd love to hear how you found the experience of working in ED. And if you have any advice for me if I were to work shift work ever again, or for anyone else. So drop your comments below, hit like and subscribe, and I'll see you in the next video.